Not responsible for any content, information, or opinions expressed. User bears full responsibility for their reliance on such content, information, or opinions.
Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Welcome back to another episode of You and Your Doctor, sponsored by All County Healthcare. We are a certified home healthcare agency. We are servicing Miami-Dade, Broward, and Palm Beach County. You can reach us directly at 954-717-7027. I am your host, Louise Gomez. Welcome to the show, everybody. And I am super excited to introduce everybody to Dr. Sandra St. Eloi. She is right here in Deerfield. She's with Florida Internal Medicine Associates. The website is FEMA.docs.com. And you're right here, 1899 West Hillsboro Boulevard, Deerfield Beach, 33442. Welcome to the show, Dr. St. Eloi.
Thank you, Louise. Thank you. I am so glad to be here.
We're so excited to have you. I know I had a little pre-conversation with you. I know we have a lot of great stuff to share.
Yes, we do.
Yes. So, Doctor, I usually like to find out a little bit more about like your background. What made you want to get into this interesting field of medicine, and what was that like for you?
So I started as a regular RN. I've been a nurse practitioner for over 20 years. And I got my doctoral degree in nursing in 2016. I started initially just in internal medicine. I have a background in internal medicine and geriatric medicine. Initially, when I started practicing, I was seeing patients in the nursing homes, in the assisted living facility.
Oh, wow.
You know, because I love my older people.
Nice.
You know, but going through it, and also I was seeing patients in the office.
Okay.
But the one thing that I did notice is, number one, by the time somebody gets older, they are so debilitated and are on so many medications. So I started wondering, what can we do in order to prevent that from happening? And besides, also in my office, I've had patients come in, you know, where they will come in and their labs are quote unquote okay,
Right.
but they felt terrible.
Yeah.
You know,
That's very common, right?
it is. And they were coming out like defeated. And I'm like, there has to be an answer to this. So that started my journey into the world of functional medicine.
I love it.
So now I integrate not only internal medicine and primary care, but also functional medicine, so that I can address people's illnesses and issues from a root cause instead of just throwing a medication at it.
Yeah.
You know, and our health is our wealth.
Absolutely.
So, and also prevention is huge for me. So that's how I started my journey. And now I'm on that path of integrative medicine, where we approach everything from a holistic standpoint and also personalized.
So I'm so impressed with the reason why you decided to start it. You listened to your inner voice and you listened to your intuition and you kept going with that. So
Yes.
That's impressive. And for you to do that and then start your own practice, that in and of itself was a journey, I'm sure.
It was a journey filled with ups and downs, turns, but you know what? I made it work.
Yes,
you know?
did.
And I am on that constant quest to know more, you know, find out more. What is the best way I can help my clients?
I love that. And that really, to me, shows the distinction of a really good doctor, because you're always curious and you're always wanting to learn more, to share more, to grow more. So you'll add the patient, the end user, gets the benefit of that.
Absolutely, absolutely. Only the best for my patients.
I love it. So what are the areas, I know you're internal medicine, so what are some of the symptoms or some of the things that your patients come in to see you for? What are some of the...
So beside chronic illness, like chronic disease management, my patient will come in with also hormonal imbalance because I also do bioidentical hormone replacement therapy, which has been my passion in the past few months because it is so undertreated, so under-recognized, particularly in women going through perimenopause and menopause, who feel dismissed, ignored, and most of the time is not by the fault of the provider. It's because of the lack of knowledge that exists even in medical school. For me, for example, I had to go outside of my traditional training in order to know how to better serve that population, how to treat them. You know, the one thing is when my patients come to see me, I want to make sure that they feel heard and the issue that they come in with is actually addressed, you know, instead of just throwing a medication at it.
I so appreciate that, and I appreciate you sharing the word about bioidentical hormones. If I can share, I've been on them for 8 or 9 years now, and it's changed my life because I didn't know what was wrong with me, and I had all these strange illnesses and weird things, and I said, no, I'm going to get to the root cause of this. Like I had massive headaches for 3 or 4 days during that particular time of the month, and I was like, I can't, what is going on? I didn't want to just take migraine medication.
Exactly.
So I dug and did my research, and it's changed my life. So there's so many women out there that don't know what to do, so I'm glad you're sharing that message.
Yes, and here's the thing. When we are going through that transition, which is a natural transition, you know, we don't even recognize the signs of what's going on. And there has been so many specialist visit, ER visit with issues that stem from perimenopause. For example, like you described, the migraines, especially around your cycles. Those are a sign of an estrogen deficiency. Sometimes just replenishing the estrogen can fix that problem. When you have women who are anxious, nervous, depressed, having panic attacks where everything was fine before, and all of a sudden you're trying to get on a plane, you cannot get on the plane because you're having a panic attack, where you've been you know, on the mile high all the time and had no issues, and all of a sudden this is happening. You know, when you have aches and pains that come out of nowhere, you have a frozen shoulder, your skin is itchy, your ears are itchy.
But this is the thing, there's so many different symptoms and issues that are so random, so you can't just say it's this or that, it's just such a broad spectrum. But you, being the specialist, and you read their labs, and you'll know it's life-changing.
Exactly.
I had no more headaches after that. No more. No more headaches. But they were migraines, debilitating.
Yes. And that's what I encounter when my women come in. And the thing is, when you listen to somebody, when you listen to a woman and you tell her, it's not in your head. What you are going through, it's actually an issue. It is, you are having a valid issue. And when I have my women actually cry, when they say, finally, somebody is listening to me. You know, they've been through 4 or 5 other providers and still not getting an answer. When women head up in the ER with palpitation, and all that is also a sign of perimenopause and menopause, you know. So that's why I'm so passionate about it, because it is so dismissed and unrecognized. And I want to be able to empower women to know what to look for and seek the care that they need.
Yes, and that's why you're here.
That's why I'm
here. We needed you to empower people. So what are some of the other common conditions you see? I know you do the hormones and whatnot. So what are some of the other common conditions that you might see in your office, and how do you treat them differently? Because I know it's a little different in your office.
Exactly. So we also do medical weight management.
Oh, good.
And the way I approach weight management is, again, root cause. It's not just, okay, you need to eat less, you need to
Sure.
eat better, you need to exercise, and then you lose the weight. I usually try to find out the cause of the weight gain. Again, could it be related to a hormonal imbalance? Is it related to a thyroid imbalance? So that's how I can help my patients succeed in their journey. And having through my own program myself, because actually I use myself as a guinea pig
Oh, good.
to see if it will work. And
I love
I put myself through my own weight loss program where I lost 50 pounds.
Wow,
And
congratulations.
I've been able to maintain it for the past year without any medications, you know.
love it.
And I use a combination of, yes, I use the GLP-1s, but I also use supplements, nutritional coaching, hormonal balance, thyroid balance in order to help you get to your
Nice.
goal.
I love that.
And also we do have other modalities that treat and re-educate the muscles,
Oh, yeah.
you know, so, and we had a prior discussion
Yes,
about
yes.
that.
Because you do also aesthetics, internal
Exactly.
medicine, overall patient wellness. I know we were discussing somebody, maybe if they have Bell's palsy or they have other issues. So you were saying you have all different modalities.
So as part of the aesthetic practice, what started just as aesthetic has merged into a functional wellness as well. So I do carry the modalities by BTL, which are the M-Sculpt Neo, the M-Face, and the M-Cella. And for the M-Sculpt Neo, it uses radio frequency and high-intensity electromagnetic energy. That's always a mouthful for me.
You did it.
And basically, what it does, it's twofold. Aesthetically, it helps melt fat up to 30%, and at the same token, you build muscle by 25%.
Wow.
So, for example, if somebody is treating their abdomen,
Yeah.
that's the only modality that will get rid of the visceral fat, that fat that is around
Is it
the
like
organ.
a device that you put over them, or?
It's a device, it's an applicator that I put on the area being treated. There's no pain.
Okay.
There's no downtime.
Okay, good.
No, absolutely not. You sit, you relax, you're comfortable, and you get your treatment.
I love
And
that.
just to give you an example, one treatment of the M-Sculpt Neo, if you're treating your abdomen, is the equivalent of doing 20,000 crunches.
Sign me up. Sign me up. I mean, come on, this is amazing.
It is.
Wow.
Yeah.
And so what else as far as aesthetics? I know you mentioned
M-Face.
something else for the face. Can you share with us a little bit more about
So
that?
the M-Face using similar technology, but it is specific to the facial muscles because the facial muscles are much thinner and smaller.
Sure.
And it also helps re-educate the muscles of the face. Like it is a facelift without any cutting,
love
without
it.
any Botox, or without any filler. Because not only it helps restore the collagen and elastin that you lose as you
Right.
get older, therefore giving you that youthful look, it also helps increase facial volume
Wow.
without any fillers. And because it works directly on the facial muscles, which is like the foundation of the face, it also helps functionally. As far as patients with Bell's palsy, I've had re-education of their muscles and decrease in the spasm of the muscles of the face. I've had a patient who had a stroke, who had right-sided facial droop to the point where she was drooling
Wow.
when she was eating.
Right.
And after her M-Face treatment, she stopped drooling
I love it.
and she had symmetry in her smile again. And she actually told me afterward, she's like, guess what? I'm like, what? For the first time, a man tried to buy me a drink. And she's 78 years
I
old.
love it.
She came back in the office beaming about
Sure.
it, you know?
So the best thing about it is not only is it non-invasive, it's natural, and not only is it natural for the medicinal, whether it's a stroke or Bell's palsy, but it also gives you the collagen and elastin.
Exactly.
We have a quick commercial break. We'll be right back.
All right.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027, or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Thank you for tuning back into our show. Welcome back to You and Your Doctor, sponsored by All County Healthcare. We are having a great conversation with Dr. Sandra St. Eloi. She's right here in Deerfield, right here at 1899 West Hillsboro Boulevard, Deerfield Beach 33442. And her phone number there is 954-725-7291. She is with Florida Internal Medicine Associates, which is FIMA.docs.com. So Dr. St. Eloi, I'm enjoying this conversation, learning about all these modalities, and I'm loving that this is right up my alley. It's like non-invasive. Mm-hmm. Nobody wants to do invasive.
Exactly.
It's non-invasive. Not only do you have medical treatments to help with the problem, but also they also, like we were discussing, collagen and elastin. So it's kind of multifaceted, which I really love.
Yeah, so we are a multifaceted practice. Not only I address your issues from the inside, but also on the outside. When you look good, you feel good, you basically want gold.
That's right.
You know, and the beauty of it is you get everything under one roof. You don't have to go anywhere else.
This is true.
You know, and all of our treatments intertwine with the internal medicine part of it. Mm-hmm. Let's say with the M-Sculpt Neo, we can do muscle re-education, which has helped a lot of our patients with balance issues who keep falling because I'm able to strengthen their muscles. So it reduces the fall risk, you know, it increases patient stability. Patient can actually walk long distances without feeling tired and have the strength to do it. You know, because it's all about muscle re-education. Patients who get injured, who've had surgery.
Oh, yes.
Definitely. It's like getting physical therapy, but on steroids.
Oh, I love it.
You know?
Yes.
And the beauty of it is no downtime.
Yeah, that's very important.
Extremely important, especially in the day and age where everybody is rushing. So you come in, get your 30-minute treatment, and then you go right back to your business.
So many women don't want to talk about the pelvic floor issues. I'm going to bring it up because we get to discuss that. So tell us a little bit more about women that may be listening right now, and what are some of the symptoms, and maybe what are some of the devices or modalities that you have to help them with that.
Yes, and that is a topic that most women are very embarrassed to talk about.
Yeah.
And any woman who's had a child knows what it does on their pelvic floor and on their bladder.
Yes.
And sometimes we take it, oh, it's normal, you know, if you cough or you sneeze or you laugh too hard, you lick a little bit of urine, it's like, oops, you know, it's normal, but it's not. It's all because of a weakness in the pelvic floor.
Yes.
Now, think about regaining your confidence again when you don't have to worry about wearing a pad, when you don't have to cross your legs because you're going to have to laugh too hard,
Yes.
or you're coughing, where you can actually be relieved of that. So the modality that we have is the MCLI. It's basically a chair
Okay.
that also is the same technology that causes supracontractions of the pelvic floor muscle and re-educates the muscle in order to reverse urinary incontinence, not only in women, but also in men as well.
Okay, good to know.
Like men who've had prostate surgery,
Sure.
you know, we've had radiation to the area, also can benefit from that modality because it helps with the incontinence. And with that, you know, imagine one session is the equivalent of 12,000 Kegels. Now, can you do a Kegel?
Wow.
You know, and most of us, we don't even do a Kegel properly, let alone 12,000.
Yes.
And the beauty of it is you sit fully clothed. There's nothing invasive, as if you're sitting for 30 minutes doing your crossword puzzle, watching TV, you know, or reading a book while you're treating your pelvic floor therapy.
Wow.
And I believe any women who've had a child
Yeah.
should even do it in order to prevent the issues later on in life.
Oh, yes. I gave birth 3 times. I know.
Yeah.
I know. So, Dr. St. Eloi, so for patients who may not be able to come into the office, how do you work with us, all county staffing and home health, to support those patients that you have? So you have some of those.
Well, all county home health is basically our eyes and ears in the field, and it helps coordinate the care of our patients. In addition to us, we do have providers who will see patients in the home.
Oh.
So we do house calls.
I
Can you
love
believe
that.
it?
No, that's amazing.
Yes. So we do house call where we provide all the services that is rendered in the office, but to the home. So we basically bring the office to you if you are unable to get out of the house. And having such a great partnership with All County makes it that much more feasible.
Yes.
You know, where I have nurses who can monitor a patient and it's just a text or a phone call away, let me know what the patient's condition is, assist me with blood work if I need to. So I can order a lot of services, including physical therapy, nursing care, wound care, even diagnostics like x-rays, ultrasound, all that can be done in the home.
I love it.
You know, and with that, not only does it assure continuity of care, it also prevents unnecessary hospitalization.
Most importantly.
Exactly, exactly.
So this is amazing. You not only have your patients coming to you, you have the partnership with us at All County. So it's like you're taking that brush and you're just making sure everyone who needs to be seen can be seen. And this is what we're so happy to hear about. I can't believe we have 3 minutes left. A couple more questions. So do you have any upcoming events, health fairs, or any special programs that maybe our audience can know about you want to share?
Sure. Like on September 29th, we are hosting an event in the office where we'll be offering free mammogram in partnership with Boca Hospital.
Oh, okay, nice.
So we'll have the mammogram van come to the office where you just call the office and sign up to have your mammogram taken. During that day, it will be a whole day of wellness where you can actually demo the modalities that we have in the office.
I'll be there.
You can actually have trials of the modalities and experience it yourself. And I'll be having talks throughout the day about hormones, hormone replacement therapy.
Nice.
In both men and women, because we treat men as well.
Good.
You know, like testosterone therapy is also huge in our male population for the same reason that they have a decline and that can adversely impact their health. So I am inviting all of you guys to come and join us on the 29th.
Yeah, I think we're going to be there for sure.
Yeah.
So we have 1 minute left. So what's the first step someone should take if they're ready to improve their health and work with you at FEMA? What should we do?
Give us a call. You know, I'm right there for you. 954-725-7291. the first step is making that consultation.
Yes.
Because your health is your wealth.
Absolutely.
You know.
I agree with you 100%. Thank you so much for coming on to the show. It's always a pleasure to speak to doctors who
was
really
amazing.
are proactive towards root cause medicine. So
absolutely. It
thank
was
you.
my pleasure. Thank you so much.
Thank you so much. All right. Have a good night, everybody. We'll see you next week.